Welcome to Parent Squad. I'm Felicia Lawrence, and today's hot topic is something impacting a lot of families across the country. We're talking about childhood obesity. Studies show the rate in Indiana is increasing. It's rising, especially in younger kids. So here to give us some insight into the issue is Tami Silverman, the president and CEO of Indiana Youth Institute. Thank you for joining us.
My pleasure. Thank you.
This is an important topic. So let's just look at the numbers. How big of an issue is childhood obesity?
As you said, it's growing. So we know that when we're looking at the number of children ages 2 through 19 who are obese, that's about 1 in 5 Indiana kids, so about 20%. When we take it a little further and look at the number of children who are overweight or obese, that goes up to 40%. So 4 out of 10 of Indiana kids fit one of those categories.
Wow. And usually the levels, so people can understand the numbers a little bit more, you have overweight and then obese would be on top of it.
Correct.
So they kind of put it in levels of impact and how seriously you should take it. And then you said ages 2 to 19. That's interesting too, that they would include 18 and 19-year-olds in the study.
Yes. Well, and this data is looking at all of our kids, right? And so looking at what are those rates over time. And one of the things that we've been seeing is that our youngest kids, particularly 2 to 5, those obesity rates have climbed the most. Over the last about 9 years, it's increased by over 80%.
Wow, in the last 9 years.
Yes.
So how did the pandemic impact those numbers?
Well, we see that it's gone up across every age group. So we know that kids are less active now than they were before the pandemic, and that's showing up in them being overweight or obese.
And then what are the health risks for these? It's not just about aesthetics or parents saying, oh, you're young, you'll walk it off later, or you'll work on it later, you have time. There are health risks to this.
There are serious health risks. And when you think about it, you kind of think about the kids might not be as comfortable being active, or they might not, jump up around and climb on things as much as they would otherwise. But we also are seeing things such as early type 2 diabetes, heart issues, and orthopedic issues, because you think about that extra weight and the pressure that puts on developing bones. It's really significant. Those are the health risks. There are also some emotional risks that can come along with children being overweight or obese.
What do you mean when you say that?
What we see is that they're a little more withdrawn. Sometimes they can be more self-isolating. They can feel self-conscious or embarrassed. Sometimes they can be bullied by other kids. And that can show up in things such as stepping away from school or activities, or being reluctant to participate with their friends that they might otherwise be more eager to do.
That makes a lot of sense. And we know just socially it can be tough as a child too. So I imagine it might play a role in that when you're talking about the emotional well-being of a child. I'm sure there's some parents who might sit back and say, well, I was a little bit bigger as a kid, or we're a little bit bigger now. It just kind of runs in my blood. It's how our family is. What would you want your message to be to them?
Genetics does play a role. Genetics plays a role. And so it's okay to understand that and take your family context into account. That being said, we also know that kids aren't moving as much as they used to. So there are things you can do. Of course, you could get your kids involved in a whole bunch of activities, but you could also have a dance party after dinner or before dinner, or go on a few little walks, or step around, take the stairs or park further away. There are small activities that you can do that also incorporate more movement. We also know that family meals are a big deal, and sharing family meals. We know that families don't do that as much as they used to, but doing that also creates an environment where you can talk about healthy food and what's important, and quality and quantity and those things. So there are things you can do in addition to understanding, we're not just talking about being a little bit bigger, or we're talking about a level of overweight that inhibits some activities and causes more risks.
Absolutely. And it's crazy because you see it in yourself as an adult, and you want the best for your kids too. And it's a two-pronged approach, as you were just mentioning. You have the diet approach, which obviously you want people to pursue a healthy diet, and then of course the fitness approach. And I'm finding in my own family, it's not even so much taking on this whole mindset of, oh, now we're these fitness crazed people. It's what can we do to just take a step towards a healthier life. lifestyle.
It is. It is. Well, and also having conversations, where else can this ripple into? You know, kids spend an awful lot of time at school. So having those conversations to say, what are the meals being served at school?
Yeah.
And how is that helping my child's nutrition or not? And so what options exist around that? Do you need to supplement or swap out or have a conversation with the school? That can be a big deal. A lot of youth serving organizations are paying attention to what are they serving out of school times, because you could be doing that in your own home perfectly well, you know, and really focusing on that. But you have to consider the other environments that your child spends time in.
Yeah, they're not always right in front of us, unfortunately. So the impact here goes beyond weight. She already mentioned some of the emotional impacts, but let's also talk about how this impacts the community as well as the economic impacts. I mean, overall, a healthier society is really just best for all of us all the way around.
It is, absolutely. And this new data and research that we had a partnership with really quantified what are those economic impacts. And they found that young children that are overweight or obese end up incurring about $19,000 of additional health care costs. And so you think about that over that number of kids that fall into these categories, and that's a significant community economic impact. In addition, you know, again, we want all of our kids to reach their full potential, and that means physically, emotionally, academically, all of those things. So we want to make sure they're healthy and they have the opportunity to do that. Part of that is also, are we ensuring that there's access to consistently nutritious food, right? So, you know, is it viable to go to the grocery store? Are the healthy groceries affordable these days? Is one of the big questions that we need to ask ourselves, you know, that goes beyond just your individual family.
Oh, certainly. We have had a lot of conversations here talking about food deserts, and I know that that is an issue in a variety of communities across the U.S., certainly having access to those foods. So our kids aren't shopping at a gas station.
Correct.
And getting those snacks and those dry snacks and things like that. Okay. So I do think it is important to note that obesity is not just a matter of personal choices. There are a lot of other factors to consider too, and you touched on several of them as well. But how do we get people and parents to realize this is about, I love what you said, your child reaching their full potential. And so to do that, you want to be you want to have them on the path to a healthy lifestyle.
You do. And so part of it's being in conversation, right? It's not about being perfect. It's not about never eating a cupcake at the birthday party or those things, but having those conversations about what are healthy foods, what are treat foods, what are healthy activities, and how do we continue to nurture those conversations in a way, this is really, really important, that's not shaming or blaming any particular child or family. Because again, we know there are so many systemic issues that are playing in the economics and the access and the food deserts, that it's not just, gosh, you're a good parent or not. It's all these factors at play, but also taking into account how can we all try to make this better so that every kid in Indiana is healthy.
Yes, and you're looking at it on a macro level, which I think it's so important. Obviously, that's what they do at the Indiana Youth Institute. But from an individual standpoint, to be able to look at and assess what's going on in your home and how together everyone can make a step forward, I think that is just really the best thing to do. So it's being attacked on multiple levels. The good news here, though, is that there are ways to reduce the trends. So let's talk about some of that both at home and in our communities. Is there an approach that, with the work that you all do on the macro level we just mentioned, is there an approach that you all take?
Absolutely. Well, and we do have some of those conversations. And then we also do want to break it down because we know many of us are parents too, right? And we want to take that into our own homes. So part of that we're talking about is really starting this health and considering weight of children from the earliest stages. And that starts with prenatal care. And that starts with healthy care for moms and making sure that those expectant moms have the nutrition they need. Part of the other issue is, and I know you have a little one that is avoiding the inclination, and many of us, I'm guilty of this as a mom, of soothing kids with food when they're upset, is giving them a treat or saying, you know,
sugar or what they want.
Correct. Sometimes that's a hard thing to do, but it's really important that we do things differently than that, and maybe than how we were raised, or you know, and teaching those healthy habits can really go a long way. And then, as we talked about, talking about what we're having for dinner, having kids help prepare food, talking to them about nutrition and portion size, and those things can really go a long way.
Because that's one thing I find, that there are still a lot of families that don't know how to eat healthy, make healthy food, make it taste good or somewhere close to good. They literally don't know what to do or how to kind of stop this wheel that might have gotten off the tracks or may have never been on the tracks.
Correct. And I think you make a great point. And there are organizations out there that can help with that, right? And so particularly Jump In, it was one of our partners on this particular research study, and they will talk to families about how do you increase the activity level? What are some easy ways you can do that? They also have references to what are some of those nutrition facts that you might not have access to. You might not, think about, here are some easy swaps you might be able to do in your own home that would really make a big difference.
Well, a lot of times they do say your children are a reflection of you. So we got to lead from the front, parents. Hopefully you found some good info in here. At the very least, Indiana Youth Institute raising awareness about what's going on in our homes so that we can do something else to, of course, help change the trends. Tami, thank you for being here.
My pleasure. Thank you.
You can read more about the report that they have released at WTHR.com/Parent Squad. We have more to come to help you be your best self. We'll be right back.